So I would like to introduce myself. My name is Dafran Lalu, data manager of IDSP. So for this training, I will be teaching you how to fill the details, the case-based details of all the patient in this portal at IHIP. All right. Okay. For this training, the URL for the training site is IHIP Okay, copy this one and then paste it in the URL search tab and then enter. Once you enter, this will take you to the main platform of IHIP. What is IHIP? The full form of IHIP is Integrated Health Information Platform. Okay, so it means that all the health information Hello. Hello, please off your. Hello. Kindly mute your audio. Okay, thank you. So IHIP is a web-based information which is being captured near real-time information, okay, by the health facility. These information are case-based, in which the detail of the patient, like name, sex, address, phone number, are being recorded in this portal. Okay, this will help to maintain the patient record for future reference and also to manage disease outbreak. As you can see over here, programs for communicable disease like IDSP, malaria. Okay, all these programs, health programs, will be integrated into one platform. Please mute your. Hello. Unable to hear. Hello. 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 Hello, can you hear me now?
Yes.
Okay, thank you. So in this platform, you'll be able to see all the health programs dealing with communicable and non-communicable. So IDSP, since it's dealing with communicable, you'll be seeing in this part. Okay, so I'll be clicking on the IDSP since this training is for IDSP. So I'll be clicking on this IDSP. After clicking on this, you'll be able to see the login site of IDSP. Okay. For the P form, the user ID is user2. Okay, and the password is okay. So the user ID is sfuser2 and the password is learn IHIP@2019. Note that the letter L is a capital, uppercase. Okay. After entering this password over here, enter the captcha, whatever appear over there, 9283, and then sign in. Okay. After signing in, this will route you to the main portal of IDSP. So the home and the above part, these two are the details or the information of IDSP. Okay. So we will skip all those two fields. We'll skip those two fields and go directly to the form.
Yeah. Okay.
Okay. Previously, before, we used to send details to us in this format. That is an aggregated data.
Okay.
You used to send us in this format in an aggregated data. But from this day onwards, you will have to send it in a case-based information. So now suppose a patient comes to your health center and first and foremost, what you have to do, you have to record the name of the patient. Suppose the name of the patient is Riba Swear, and the age of the patient is 5 years old. Okay? Her address is Mount Phone number after you have written this information in the OPD slip, this slip will go to the doctor. Okay, the doctor will examine the patient, whatever she's suffering from. Suppose fever with rash. Okay, and the doctor advised this patient okay, after the doctor examined this patient and he found out that after the doctor examined the patient and she finds out that the patient is suffering from is having this fever with rash, and she advised that the patient to do for testing for scrub typhus. And also, she said that this patient need to do a test of measles. Okay. Once you get this information, you'll be recorded into the OPD register. And after recording all the other patients, this information needs to be filled in this portal. So the phone number is given like this. So I'll just copy this number. I'll choose it over here. And then the first name is Riba Swear. There are two options over here, date of birth and age. You can select date of birth if she provides you the date of birth. If not, go to age. And the age of the patient is 5. So click on 5. So the gender, female. ID type, you have to select not available. Okay. Since this is a training site, the address, district and taluka will be Karnataka, Tamakuru and Tiptur. You can't change this information. Okay. Okay. Once, if you change this one, then you won't be able to save. You won't be able to save. Okay. And as you can see over here, this asterisk mark is mandatory. So whatever field where this asterisk mark exists, in this field you have to fill. You can't leave it blank. Suppose in this visit part, I won't select any village. We'll see what will happen. Okay. So since in the OPD slip, I found out that this person, Ribasware, she is suffering from fever with rash. And note that the doctor should always provide this date of onset. As you can see over here, date of onset is mandatory. Okay. So the doctor should provide this information also in the OPD slip. Date of onset will say that she's suffering this disease right from 1st of March 2021. Okay. So the doctor needs to provide this information, because if this information is not provided by the doctor, then you won't be able to fill this detail in this portal. Okay. Please advise your doctor to ask for the date of onset. Okay. So since the doctor asks his patient to go to do the test for scrub typhus and measles, I'll select scrub typhus for the lab test, and type of sample, I'll go with blood. Collection date is today, and test requested for Zyphilix. Since there are two tests required to do, so this plus sign over here, it means that for another test. Okay. Once you click over here, you will have another field where you can add another test. Okay. So I'll give measles over here, Saron. Collection date is today, and test requested for IHIP Melissa. Okay. So in this field laboratory 3.8, there are two parts, internal and external. You can select external and select the name of the hospital. But as for now, I request you to select on internal only. Even if you send a sample outside, please select internal only. Okay? Because you won't know whether those people from those hospitals where you are sending this sample, whether they'll update or not the information, the result. Okay. So if they don't update the result, the outcome of the result, then this patient sample will be pending. Okay. So for now, please click on internal. So I'll try to save this information. Once I click on save, this information will pop up on this line list. I'll try to save, but previously I've already told you that I didn't select this village. Intentionally, I didn't select this village. We'll see what will happen if I save. Okay, this information cannot be saved since I didn't select any village. So I have to select, I shouldn't leave the field that is mandatory. The asterisk mark, it shows that this field is mandatory. So I'll select any village from here and then I'll try to save this information. Okay, data saved successfully. You can see over here two patients, the two samples by the name of Riba Swear. This information up to this point, it is saved only in this profile, in your profile ID SF user 2. So the person who's in the lab or from the district or the state level, they won't be able to see this information unless you click on submit. But note that if you click submit, you won't be able to change the information that have been provided by you. Okay. So if you have make any error while submitting this information in this platform, okay, so you can still edit before you submit. Okay, click on this edit part and do the editing if required. Okay, and after editing, you go to this update part and then click over here. It'll be updated. Okay. Then I'll submit this information. Once I submit this information, the person who's in the lab will be able to see this information provided by you. So are you sure you want to submit the batch of record? You click on yes. This information will be shared to the lab, district, state, and even to the ministry. So I'll try to look out this one and check whether this information is there or not in the lab. So for the lab, the user ID is LB, user 2, and the password is the same. The password is the same. Okay? So whatever captcha appear over there, I'll just type and then enter. Once I enter, this will take me to the lab profile, LV user 2. From this, you click on form, laboratory case, and then on your keyboard, click Ctrl F and search the name of the patient, Riba Swear. Okay, this is the patient that have been added through the P form. And what the lab tech need to do after finding out the result of this patient, you click on this edit part and scroll down to 3.9, the date of test performed. When did he perform the test? And the result, whether it's positive or negative, I'll give positive. And the pathogens, measles virus, and remarks, if required, since this is optional. Okay? Then I click on update. As you can see over here, this information have been updated and this result came out to be positive. Okay. So likewise, I can do with this 3127. I click on edit, go to 3.9, date of test performed, click the date, positive or negative, I'll give negative, and remark is optional, so I'll just leave it blank, and then update. Okay. So up to this point, the lab tech, you can still change this information if suppose 3127 by mistake he has given positive, but it is negative. He can still edit this information by clicking on this edit part and then change the result and update. The lab tech needs to do only 3 steps. Does perform, result, remarks if required. That's the only 3 steps that he have to do. Okay. Once he has given the result, he can click on submit. But note that it's like the same case like in the P form. Once he submitted this information, it can't be changed anymore. So I request the lab tech to check it before sending the report. So I'll click on submit and yes. Okay, this information are no more in this line list since you have already submitted in the data, so it won't be polluted in this line list anymore. And I'll lock out this user ID and I'll go back to the P form. Okay, now suppose after a week or two, this person Riba came again to your health center. What you will do? You click on this search part and search the first name, Riba. Okay, or you can search it with the phone number. Okay, it's the same thing only. So select this person. This person, the information of this person need not to be entered again. Okay, for the second time, if he comes and visit your health center, you just need to go to this search part and select the name of the person. Select the name of the person. All the details being filled by you previously will be automatically filled in this field, the patient detail. What you need to do in the next step, you have to select the provisional diagnosis given by the doctor. Okay, date of onset, OPD, and if required for testing, click on do you want to test? Click on test. Okay, so I'll go with typhoid. Do you want to test? Collect sample? Click yes. If the doctor says, okay, if this patient need not to do for test, then you don't need to select this one and then just save this patient record. Okay, so if required, click on this and the laboratory detail will pop up and select whatever need to be. I'll go with vital and then save this information. And then submit. Once I've submitted this information will go to the lab. If I didn't submit this information, then it won't pop up in the lab. Okay? So I will show you the list of diseases that are under this IDSP. Okay? These are the diseases that you'll find in this portal. Only these diseases need to be captured and enter in this portal. Okay? So up to this part, I think that is not that hard or difficult to enter. So what you need to do, click on form, go to presented cases form, and this page will appear. Okay. Now suppose if there's a death record in your hospital, click on death report, fill the name of the patient, or you can search the patient name. Select it, and when did she expired, select on the date and save the record. And then submit it. If there's a death case in your hospital, click this add death record and then fill the details and then submit. Okay. And for the last part, record aggregate data. This information can be filled by you only if you are allowed to enter with the permission of the DSO. Okay? Else you won't be able to enter this information over here. Okay? So I think up to this part, everyone have understand how to fill the forms. Okay, I'll just assume that you have already understood. So I'll go to the next part, that is the event alert form. What is this form required for? Event alert is an event that needs to notify the higher authority because such event can likely cause an outbreak. Okay, now suppose if a patient is suffering from JE, and if from the health department they don't go and investigate the case and they don't provide medical aid to that patient, that disease can likely spread and cause an outbreak. So with the help of this event alert form, we can alert the higher authority so that they can send the RT member and investigate the incident. Okay. So if such case occurred in your health facility, what you need to do, you have to select the date. When did you find this information? Okay. And select the village, health condition, suppose it's JE. Source, you are getting this information from the health worker, and message, you have to type the message whatever. One case, suspected case of JE in Maung up Mar BC. Okay. So if you have any documents that can support this case, click on choose file. Okay, and then submit this information. If you submit this information will directly pop up in the form of a SMS alert, instant alert SMS, in the phone number of your medical officer in charge, DSO, SSO. This information will instantly pop up in the message. So I'll try to submit this one. And this information will also appear in this outbreak. Okay. This one is new, GE. If you click on this, you'll be able to find this information given by you. So once the DSO receives this information that one suspected case of GE in Maungap, Barbishu, he will send the RT member to the area and try to investigate this incident. If the RT member came to find out that this information is true, the RT member will call the DSO and tell him the information, and from the DSO he will convert this information into an ongoing under surveillance. If not, he'll close this investigation. Okay. When the RT member reaches your area, he will write the event information update, like does this patient have any travel history? Okay. Close contact. Three numbers. All information will be provided by the RT member, and the health response whether these close contacts have been given medicine or not, provided medicine to this close contact or not. Okay, all this information will be filled by the RT member. So after you have submitted all this information, he'll click on save, and if required for the line list, he'll add the name of those close contact, the name of the patient, and even the close contact, and then submit it, save it, and it will appear in this form. Okay, and then he'll submit it. Once this investigation has been closed, controlled and closed by the DSO, the health facility need not to write the report anymore. You just need to click on this print, and all the information given by the RT member, this will be the report of this incident. Okay? Up to this point, is there any problem? Okay, thank you. Then we'll go to the report part. Disease summary. For this disease summary, you can select the date from which date to which date that you want to view the number of diseases appear in this health in your health facility. Okay? And then after selecting the date from this date to this date, from 1st to 11, you click on this disease. Okay? Only these diseases that have been highlighted over here can be viewed. Okay, I'll select typhoid and chickenpox. After selecting this one, I'll click outside the box, and these are the diseases, the number of diseases of chickenpox reported in your health facility, and you can view it through pie chart and even on the map. 12 cases. If you further zoom this one, there's a cluster case of chickenpox in this area. Okay, so you can further view it in a line list. Twelve cases, and these are the name of those patients suffering from chickenpox in your area, from 1st till 11 of this month. And we'll check the lab report. On the 7, we have one case, one positive, and all the cases that have been sent for the lab are all positive. So likewise for typhoid, the pathogens also you'll be able to see in this chart, and the number of cases on the week number 9 is 22. So you can see the detail over here, 37 to 2. If I further zoom this one, from 37 it will spread 35, 1, 1. Okay, in the map also you'll be able to see, since this one have been provided by Q all the information where the address, the following address of the patient. The line list also you'll be able to view. There are 41 cases, and this one you can download it and print out this information. This is the disease summary, and we'll go to the next part, is reporting status summary. This is like the attendance, your attendance. Okay, so if you click on the week number 4, you'll be able to see this one, 31st of January. There is no activity in your P form and even the L form. Okay, and on the 6th, the L form, there is no activity. So I will request all of you to at least log in, and once a day, at least log in. Because if you don't log in, all these dates will appear in red color, and the people from Delhi will try to find out why you didn't update this information in your health facility. So if you log in and log out once, if there's no case or so, at least log in once, so that this won't appear red. Okay? And we'll go to the next part, that is S form reporting status. Select the subcenter, village not required, and then search. Okay, it's not available. Since this one is just a training site, so you won't be able to see it, all the field. So we'll go to this suspected case form summary. That is from the subcenter level. So I'll select the subcenter, and the date is from 11 second month, 2nd February till this date. This also is blank. So I'll select the date. But in the actual site, you'll be able to see all the information of the subcenter. Okay. So I'll go to this presumptive case, says form summary. You can select the date from which date to this which date, and then search from this date to this date. You have these many patients recorded in your OPD. And the lab case, summary case, from this date to this date, if we search number of tests done, and the positive case is 59 for COVID-19. This is just a report for you to view how many cases are there from this month to this month. Okay? And patient history record. This will really help the doctor. Now suppose if a patient is an elderly person and you have no idea about the doctor, he can search the name of the patient. All the records of the patient will be available in this field. Okay? And then the last part is the lab performance report. In the actual site, you'll be able to view all those reports. But in this training site, since it's a training site, so most of the field have been removed by the programmers. So view map and this disease summary is the same. Okay. It'll be exactly like this only for the view map. Exactly the same like this. So if you want to view, you can select the facility name, write the name of the facility. But since this is a training site, you won't be able to search the name of those facility. The type okay, you can search the health subcenter, the location of those health subcenter in this area. Okay, or you can influencer level 3. You can search this one also. Okay, there are none in this area. So With the help of this map, you will be able to find the nearby lab or hospital or clinic. If there is available in this information in this platform. Okay. So since this is a training site, you won't be able to view all those things. But in the actual one, you'll be able to view all those information that needed. Okay, I'll try with the civil hostel. Oh no, it's not available. So up to this point, is there any queries that you need to discuss with me? Hello?
No.
Okay, if there's none, then I will log out this training site and then go with this actual site. So the actual site is iship.nsp.gov.in. You copy this URL and then paste in this URL search tab. It'll be exactly the same just like the training site where you'll find all the health programs. I'll click on IDSP. Okay, I'll go to sign in. And then I'll take as an example of this lightning code. I'll copy the user ID and the password will be this one for the P form and the captcha and enter this. Okay, once you enter this your ID, your PSC or CSC ID, okay, you have to provide the name, last name, date of birth, all this information you have to provide. Okay, and for the P form, that is FF, this one is for the pharmacist, not the medical officer. Okay, so I'll just hello, is there anyone from Lilicot today? Any participant from Lilicot? Okay, do you have any idea who's the pharmacist in Lilicot? Hello. Okay, I'll just write Mr. X. Okay, and then I'll update this one. Later on, this person from Lilicot, the pharmacist from Lilicot, he can re-edit by clicking on this SF profile, my profile, and then edit this information. Okay, and he can go to this update facility details, and in this action part he can edit the facility details like the name of the doctor, medical officer in charge, Dr. A. Shabong, his phone number, okay, and even the email ID. You can change it later on. And you can click on this validate location in the map. This will show where is this taxi located at. Okay, and then update this. After providing all the information, you can click on update. The next part is essential medicine list. So I'll request the pharmacist to update this information: essential medicine list, emergency medicine list, and supplies. Okay. So health workforce detail. This information needs to be edited as soon as possible. And the P form will look exactly the same like the training site. Okay. This is a P form. So I'll look out this P form and then enter this lab. With the lab ID, I'll enter over here, and the password will be EKH@. And with this one also, I'll do Mr. X. Okay, date of birth, male, gender. This one will be lab tech. Later on, this person from Lalicot, the lab tech from Lalicot, he can re-edit his information and then update.